we have so much to cover today. So everyone, welcome to this AI for Women's Health event to celebrate in advance the International Women's Day. We're so lucky to have amazing speakers today. And I should introduce myself first. So my name is Bianca. I, together with Kristen, Emma, and Annalisa, run this community, academic community, as part of the clinical AI group hosted at the Alan Turing Institute in London. And we organize events such as this one online, but also I would like to advertise our first ever hybrid event that is going to take place on the 5th of June in Cambridge. And this event is free and open to all of you. So I'm just going to share that link as well in the chat. And for those of you who haven't seen, I also sent the link to the Slido, which we are using today to ask questions to our panelists. You are also welcome to use the chat in Zoom if you find it easier. But bear in mind, we have limited time, so it will be much easier if everyone is asking questions in Slido. And without further ado, I will just let the panelists introduce themselves and then we can start the panel session. Thank you. So Susan, do you want to start?
Hi everyone, my name is Susan Shelmerdine. I'm a consultant radiologist working at Great Ormond Street Children's Hospital, specialising in children's imaging, and also an NIHR Advanced Fellow, which means I'm a postdoc researcher. A lot of my research is focusing on how we can use AI for children who are a very, very underserved population and who face huge amount of bias, especially in the digital innovation world. It's a delight to be here with you today.
Amazing, thank you. And I should have mentioned, so I will just jump in for a minute. I should mention that all of our panelists have received a recognition from the NHS and the Department of Health and Social Care, and this is an amazing opportunity for us to have them. They were recognized, including us actually, the AI for Women's Health Network, as AI Visionaries, and this is why we are so lucky to have them today to discuss some of their work in this field. Fran, would you like to go for next?
Lovely, thank you. Yes, also a real pleasure to be here. So I'm Dr. Fran Conti-Ramsden. I'm also a clinician. So I'm an Obstetrics and Gynaecology Registrar, returning to clinical practice later this year. I'm also an academic. I'm shortly to be submitting my thesis in the field of pregnancy hypertension. And over the last 3 years, I've been working in clinical trials, real-world electronic health record data studies, genetics, and then most recently working on some AI and NLP projects on pregnancy hypertension within the CogStack team. And in the last couple of months, I've also started doing some commercial work. So I'm currently Chief Medical Officer at a femtech startup, which is Meggy Health, developing a digital cardiovascular solution for pregnancy hypertension. And so yeah, delighted to be here.
So much amazing work that you're doing. This is great. And our final panelist is Annalisa, our very own Annalisa, who's also part of this AI for Women's Health network. So Annalisa, would you like to introduce yourself?
Thank you. Thank you for inviting me as one of the panelists for today's session. My name is Annalisa and I'm an associate professor at Teesside University in the north of the UK. I mostly work around AI application for cancer research, and I have kind of an unusual career. So after my PhD in computational biology in Cambridge, I went for a teaching career, and then I came back from teaching and went back to academia, so Teesside University. And yeah, it's really a pleasure to be here today, just discussing the novelties around AI for women's health. Thanks again for the invitation.
Amazing. And now I will hand over to Kristen, who will lead the questions.
Okay, great. Thank you. And thank you all again for being on the panel today. It's really great to have you all. So I think the first question that we'll start off with is one that we've got on our Slido. So this question is, what are some of the biggest challenges women face in science today? And how can institutions better support gender equity in research and academia? So Susan, if you'd like to start.
Thanks. I think some of the biggest challenges include a lack of role models, a lack of understanding where you fit in. I think a lot of not understanding whether or not you are welcome into that world as well, having that support and confidence and sponsorship, not just mentorship, but having someone believe in you and put you forward for those roles is not something I see quite a lot or people talk about. Everyone talks about being mentored or having people around them who, you know, guide them, but really, does that translate into people in leadership? I'm not sure. And I think you really need to have allies and sponsors in order to help you grow and put you forward and recommend you for certain roles, you know, invite you into rooms that you otherwise wouldn't have a say in. So I think that's one of the biggest challenges I'd like to see corrected.
Thank you so much. And Fran, would you like to add to this?
Yeah, and I think I feel like I'm relatively new in the sort of the AI field. I've been working with data for a long time, and then increasingly realizing that like AI and data are completely intertwined. And I think when I started working in this field, I was really sort of nervous that I was like, do I have enough technical skills? Like, I don't have a computing background, I don't have a maths background, I have a science background, and then obviously medical training. But I felt really like I wasn't really sure what I would offer in a sort of AI space. But I think what's been really interesting, sort of working more through my research, but also, going to events and understanding what's happening in this area, is that you really do need a whole range of expertise and backgrounds for this technology to work for women and for women's health. The data gaps are so enormous. And I think so often you see a technology-focused approach to, the technology leading and saying, well, we can do this, so why don't we deploy it, rather than thinking, where are the problems and how do we solve them? So I think actually, in terms of solving these issues, we need people who've got clinical expertise. We need patient voices to be part of this. So to solve some of the most complex problems in women's health, and to make sure that the technology is doing good and not just creating more work or a lot of smoke and not much fire, I think we really need a whole range of skill sets alongside the sort of the technical AI and deep tech experts.
Yeah, I think that's really great. Thank you. Annalisa, would you like to add?
Yeah, I just want to add just one small thing, just to what Susan was saying before about having the good role models and having someone that believes in you. Because sometimes as women, we tend to think that it's just probably some part of our kind of personalities. We tend to doubt ourselves, and having someone that believes in you, just you can rely to ask questions or support you or make you feel valuable. It's really important throughout your career. So that type of mentorship role is actually very important.
Okay, great. So, and I'm going to switch gears a little bit and kind of go into your background. So, what inspired you to work at the intersection of AI and health, and sort of how did you get into that line of research?
So I had quite an unusual serendipitous route into it. 10 years ago, I was doing a fellowship in Toronto in Canada, and one of the trainees started telling me about this fantastical software that could detect different things on chest x-rays and give you a probability score. And it sounded so magical and so out of this world that I really felt like, what is this? Is this some kind of crazy thing that he's working on? Has this got legs? And sooner or later, I started seeing AI pop up in lots and lots of medical conferences. It was like hugely hyped up. And I thought, wow, how can I try to understand it better? A lot of people were saying it's a fad. Why are you wasting your time with it? It's here today, gone tomorrow, like every other fad. But I really thought, well, this sounds like some magical tool. And if it can help us be better, faster, stronger, more intelligent, do better care, then why wouldn't I want to learn about it and know how we can use it in practice? My PhD was actually in postmortem imaging, so nothing to do with big data or AI. And I'd like to tell you that you don't have to have done stuff in that if you want to still rebrand yourself or reshape a career. But what I did have was clinical knowledge about fractures and trauma and forensic medicine. And so I thought, well, actually, AI is pretty good at picking up fractures on x-rays. Could I try to pivot and use that for children's imaging and see whether or not we can better detect trauma and injury in children? Because we know a lot of people don't necessarily get trained in pediatrics, or at least trained to the same level that they should. And it's an area that people are really scared of. Everybody's like, oh no, it's a child patient. Whereas I'm like, oh God, it's an adult. So, I wanted other people to feel that love for kids as I do. And so I thought, let's do this. Let's try and evaluate this, learn about it, and grow in this kind of research element. So that's how I got into it.
Okay, great. Fran.
Yes, I think in terms of, I think my route also, again, pretty serendipitous. I think, I started purely in science. I did my undergrad at Cambridge in natural sciences, then sort of realized I wanted to do medicine and did grad med. And I've really been on a clinical academic pathway ever since. So did, AFP and ACF. And I think I really got interested in data about 4 years ago. And developed my entire sort of fellowship around using data, various big data, so genetic data, electronic health record data. And I think just what's inspired me about AI and digital health is that I think, and why I'm sort of moving more into that side, is because there's just this unprecedented, there is an amazing ability to do good, I think, with the technology on offer now. And I'll give an example. So at the moment, women, once they've had their baby and they've had a medical condition, because postnatal care in the UK is fairly shocking. I don't think I'm, I think most people would agree with me, whether they work in the NHS or not, whether you've been a mum that's been through this or you work in the NHS health service, the follow-up for medical conditions is very, very patchy. And actually, with digital health and AI, we can do something about this. We have conversational models now. We can give women support. We can give women information at a scale that was just, you couldn't have imagined it a few years ago. So I think there's some really exciting opportunities to just do things a lot better at scale, but also importantly, equitably. And that's why we need to have, people thinking about these problems 360. So it's not just the tech side, right? But also like the human side and the clinical side and what patients need, and from a regulatory perspective and what's safe. And I think, but, with the right people working on these problems, I think we can really, really make a difference for women's health. Because of that scalability and because we can personalize messaging. So a lot of it is not about like knowledge generation, like if we could just implement what we know in medicine, that would already be game changing, And there's also really exciting kind of innovations and research happening in terms of the technology itself and domain knowledge itself. But from a clinical perspective, actually just getting the right message to the right person at the right time, empowering women with the information that they need at key points in their kind of in their lives and their life stages, I think is really, really exciting.
Great, thank you. Annalisa.
Yeah, for me it was also kind of unexpected to end up in this field. So when I actually started my undergraduate degree in mathematics, I started it because I wanted to be a teacher. So after 5 years of studying mathematics, I realized that I wanted to use all that knowledge to do something good. And that's what took me to a PhD in Cambridge in computational biology, where I could apply my knowledge in cancer research. So it was just kind of the idea of using what I had studied for 5 years to help people and society in general made me feel like I was actually doing something useful with my knowledge. And that's how I ended up doing cancer research. But after that, we keep following research, and that's mathematics became statistics, and then statistics became machine learning, and now it's AI. So that was my journey and how I ended up in this field. And I think it's something that we need to keep in mind, is especially for the young generation, we are studying, or they are studying for a job that probably doesn't even exist yet. That's what I did for my research, for my degree, for example. I was studying maths, but AI for women's health was not even something that we could ever think about. So just the message for the young people out there is just study what you're passionate about, and then everything else will follow.
Great, that's great advice. Thank you. So I'm going to move into a different set of questions, kind of talking about the field of AI in general. So how is AI currently being used to address gaps in healthcare? And then kind of transitioning into, do you think AI can help close gender disparities in medical research and healthcare access?
in my field, it's not used that much. I mean, of more than 1,000 regulatory approved AI devices for healthcare, less than 3% are actually available for pediatric usage. So there's a huge gap there, maybe not so much gender gap, but definitely age gap. And what can we do? What is it being used for? At the moment, it's very much not clinical facing. A lot of the AI that's being used is very back office kind of administrative roles, particularly in my area. And also quite a lot of AI right now is used for image processing, not so much diagnosis as much. I think it could be used for greater good, for sure. And I'm really proud that I've been leading this multi-society statement paper that's due to be published later on, where I've brought all the pediatric radiology societies across the world to talk about what they think needs to be implemented for safe, responsible AI for children. And it comes from just simple things like, for example, did you know we looked at all the CE marked AI products that are available for imaging across Europe? And whilst there are very few for children, actually, if you were a responsible person who wanted to use an AI tool for children, in 44% of the cases, the branding, the marketing, the detail doesn't even tell you if it's safe or not safe to use for children. It's not even there. Like, you can't even find that information from just what's on available, even if you wanted to do the right thing. So I really hope that, that we at least advocate for the vendors and for people who are going to be purchasing these tools to really think hard about what they're using and do the right thing, share the right information, and be hugely transparent, because that is still missing. And I don't know that people 100% realize that as such.
Great, thank you so much. That's really interesting as well. I'd love to hear more about some of the research that you're going to publish on this as well. Fran.
Yeah, thank you. So I think there's a really interesting work, Susan, and I think really taps into something that I've been thinking quite a lot about, which is, I think we need to conceptualize AI just as we would do anything else that we want to implement clinically. So if you're thinking like a new drug or a new pathway, we have to test it, and it needs to be rigorously tested. We need to know it's safe. We need to know how it works. We need to know how it works in women. We need to know how it works in children. We need to know how it works in different ethnic groups. And I think one of the what's sort of unique about AI is that because of the hype, people, I think, perhaps forget that we need to test it in the same way that we test anything in medicine. And there's a huge amount of money being thrown at these companies to develop products, and then they haven't necessarily done that kind of due diligence on the, does it improve clinical outcomes? How does it affect clinical workflow? What's the cost, the health economic analysis? And if you were going to do a new drug, that's a very highly regulated space. So all of that is very, very clear. But I think particularly sort of thinking about software as a medical device terrain, so where AI is being used in these softwares for clinical workflows or for patients, we need to be tested in the same way, but the regulation just isn't there yet. And it's also a moving target. So the regulators haven't quite caught up to where the tech is operating. And that just makes it a very difficult space to actually lead to clinical translation. So yeah, and I think, so interestingly, so I've just recently found out I've been accepted onto cohort 4 of the Clinical AI Fellowship Program, and I'll be starting that in August this year. But that program was actually set up to address this bottleneck, which is implementation. So there's loads of solutions out there. Like the tech, I don't think is the problem at all. The tech is available, the tech can do amazing things, and the tech is like advancing at such a pace. The issue we have in terms of, from a sort of an NHS and a clinical perspective, is getting these solutions into live clinical workflows. And so the fellowship has been actually funded by NHS England for this purpose explicitly, because they've recognized that the bottleneck is having sort of clinicians who can speak the language with all the multiple stakeholders that you need to be able to drive these innovations through to clinical practice. So I think that's really important to recognize, again, that, yes, as well as the technical expertise, you need like the clinicians on board to also understand like what's the technology literacy level in your hospital, like the people who need to use this tech, like will they be able to use it? Will they understand it? How does it impact their workflow? We also need to think about like job planning, like which jobs like might be replaced, which jobs is it decision support, they're really, really big questions, and it needs, like I said, like really 360 thinking from multiple stakeholders and groups. The only other thing I wanted to really mention from a sort of addressing women's health and women's health gaps is that AI cannot fix the data gap problem. So AI is trained on data. If the data does not exist, or the data is biased, AI will not help you. It cannot, you can ask it to generate synthetic data, but like, good luck to you. And also, if it's biased, AI often amplifies bias. So I think we need to be there's lots of amazing things that AI can do. And I think radiology is an incredible example where processing images, AI doesn't get tired, human doctors get tired. So AI decision support, and I'm not qualified to talk about this, but radiology makes a lot of sense where there are rules-based sort of repetitive tasks that need like very detailed data analysis. Like that's a perfect situation for AI. But there are some areas, like for example, how do drugs work in pregnant women? We have almost no trial data because drug companies don't fund trials in pregnant women because it's too risky. AI can't fix that problem because we don't have the data. The fact that genetics is massively Eurocentric, so like something like 80% of all genetic data is in European ancestry individuals. Again, AI cannot fix that problem. We need to do studies in more diverse populations to understand human diversity and genetic variation. Like just like all knowledge, like you don't know what you don't know, and AI can't fix that problem. So I think we really need to differentiate the sort of AI technological capabilities and what they can do with good quality data. But the AI does not fix the data problems. Like garbage in, garbage out is absolutely true for AI in my experience as much as for anything else. And so one of the key things that I do in my work with electronic health records is thinking about, okay, so how is bias going to be encoded in this data set? How do I need to look at this to make sure that any model that I generate is going to work on, is going to work for women equitably and not just the people who I have represented. And why might there be missing data, for example? So the same data issues that you have for any kind of database project, it's going to be the same with AI, and we've got to be so mindful that AI cannot fix those problems for us. But I'd love to hear what other people think. That's my view.
Great, thank you so much, and obviously agree that the data is the biggest issue when we're talking through all of this. So Annalisa, if you want to add.
I can probably give my perspective from the technical point of view. So for instance, Susan, yeah, I totally understand when you and I agree with you when you say that we always need to have clinicians on board from the very beginning, because that will it's like game changing when you develop your AI models. And I've seen this every day in my research. Yeah, having a clinician on board will just change the way you approach the problem, and it will just speed up so much anything that you're doing. So just totally on board with that. In terms of the challenges with the data and the bias, unfortunately, there isn't much yet that we can do. So AI, of course, can help with generating new data, but as we know, it's still synthetic data, so it's got still some of those challenges associated with that. At the end of the day, we need to think that AI is a tool, and it's our responsibility to use it as such. So if there is any bias in the data and we are aware of that, probably using that as an extra information that we give to the model. So there are lots of techniques like weighted training approaches that will inform the model that there is a bias within the data that we are providing. And that's probably one of the easiest solutions that we can integrate into any model. So just informing the model of an unbalanced availability of the data. And there are lots of technical approaches that you can use in that case, but I believe it's just a matter of time. As new data will be available, we'll be able to address that gap also around women's health and the availability of the data. And again, data has been generated at such an enormous and a quick rate that it's just, again, a matter of time. We do what we can. We're trying our best with the current data, but I'm sure that this hopefully is not going to be a problem as we keep raising awareness about bias in AI. This will hopefully not be a problem in a few years' time.
Great, thanks. And I think Susan had something that she wanted to add as well.
Yes, I think you both raised really amazing, great issues. And one of the things I just wanted to highlight was, there are tech problems, but then there are also society problems, and we really shouldn't confuse the two together. They do play into each other, but they are not the same thing. And obviously, bias, discrimination, stereotyping is a society problem. Let's not call it necessarily an AI issue. AI has fed on it because it exists, but it's holding up a mirror to what we have in society right now. I've often thought a lot about this as a thought experiment. If you have a totally biased and unethical AI system, and an ethical, righteous, well-meaning person is using it, will it influence that person to be unethical? And I think the answer is yes, because we will defer to the technology. What about the other way around? What if you had a truly amazingly unbiased, great AI that, you know, is fair and true and transparent, but you have a person who is, I don't know, let's say gender biased or stereotyped or racist or something? Does that AI make that person or that healthcare professional good? No, I don't think so. I think that still would exist. And so I think there's a huge amount of education we still need to do for society, regardless of how good we make the AI. And it has to happen together, not just fixing the AI to fix society. The team from Birmingham who run the Standing Together initiative, which I'm sure many of you know, Professor Alistair Denniston and Xiao have spoken at the Alan Turing before. They call it something like, it's almost as if you're holding a mirror up to yourself and you've got a stain on your shirt. And instead of fixing that stain on your shirt, you're like cleaning the mirror to make it even more clean because you want to remove that bias, but the bias exists on you. And so it's really, you know, beholden on us as people, as humans, to really try to fix that as well and not just think it has to be just the model. And unfortunately, as the other two speakers have alluded to, the data to make that may or may not exist or may not be real. You know, where does a bias become a risk factor versus a bias? You know, some women are more prone to certain diseases than men, and some races are more prone to certain diseases, and sometimes that's useful, but sometimes that could be taken to an extreme and discrimination. And we kind of have to be mindful of the two, and we don't always know, because I'll take an example for women. For example, one could say or assume that women are more emotional or more prone to hysteria or something. But that is a gender discrimination that has been perpetuated by old-fashioned beliefs, because women weren't necessarily given the medical care they deserved in the past. But if we use that to influence AI, then we're just perpetuating the past, and we need new data to disprove old beliefs as well. So it is a difficult situation, but I just make that point for what it's worth. Sometimes the bias that we see in the systems kind of actually highlights to us where we need to be doing better as well, so we can use it for that good.
Great, thank you so much. I think that's super important point to recognize. So thank you, Susan, for bringing that up. So I'm going to go to one more question, and then I think we'll go to the Slido after that. So this question is sort of about the future of the research and everything. So what are the key priorities for advancing AI in health over the next 5 to 10 years?
Sorry, I feel like I've spoken a lot, but I'll just go first, given that that's the pattern. A few things really, and I think they have been touched upon by the other two speakers here today. First, are we solving the right problems with AI? You know, as I said before, and also in the chat, 80% of AI tools are there for radiology, but is radiology contributing to 80% of our healthcare problems, right? So there's clearly quite a lot of use cases out there that are not given the due care and attention they need to be. Secondly, a lot of the work that we do has focused on diagnostic accuracy trials, but not so much on patient outcomes, return on investment, sustainability. How are we going to actually move that needle so that people get the care they need and not just kind of try to do what we're already doing, but faster? Because I think we need a bit more transformation in the healthcare system to make it work for all. We've got people burning out. We've got more and more people queuing up behind us to have investigations done, and we kind of can't keep going the way we're going right now. So I think it's more in research about the real world and human factors and the human cost of what this AI could help or, you know, do to our detriment as well, both sides as well. That's where I see it going.
Yeah, thank you, Susan. And I think, I mean, there was a really exciting announcement just last month from the Department of Health and Social Care and NHS England around using AI for breast cancer screening in radiology, where I think radiology is one of the most mature specialties, medical specialties that is, in terms of using AI. And as Susan has sort of mentioned, sort of beautifully illustrates that where that I'm not going to use the word easy because that massively undermines, I'm sure, the amount of work it is, but where there's this sort of there's a natural fit between the technology and the problems. Like, obviously innovation is much faster, but in other sectors, I think it's much slower. And that's also possibly also because the kind of people I think radiologists are probably more like techie people. They're more kind of that's probably been more kind of the remit, whereas maybe other medical specialties maybe less. I'm not sure if anyone's looked into that, but I think the NIHR has funded this trial, and it's going to be I think it's going to be using the AI tools, and they're using several AI tools, so not just one, but screening 700,000 women across the country using AI assisted assessment of the mammographies. And if this works, and that's why a clinical trial of this scale is so important, it's adequately powered, they will be able to cut the number of radiologists needed to assess from 2 to 1. And what that creates is time, right? More time for the clinicians, and then really interesting questions about, like, what do we do with that time? Do we overburden them with just like, okay, now you get 20 minutes instead of 40 minutes? Like, there's a whole load of interesting questions there. But I think what it shows is that when the right people the right organizations, the right frameworks are in place, you've got the funder, you've got the hospitals, you've got the buy-in from the clinicians, you've got the technology. I'm sure a huge amount has gone in from the patient and public experience side and lived experience voices. This will provide definitive evidence. And on the back of this trial, we will know, does AI assessment of screening of mammograms improve, reduce time of clinical workflows? Yes or no? What's the impact on the healthcare professionals? What's the impact on the patients? What's the impact from a cost perspective? And this is the kind of data that we need to be able to, this is obviously huge scale, and I think it's a world first, if I'm not wrong. So, but it shows how complex it is to get the information that we need to be really truly leading to like implementation, where we are impacting live clinical workflows and when we have this level of safety. And Susan, I'm not sure if you wanted to add to this from a radiology perspective, but I think it goes to show kind of what's needed, and it's not dissimilar to how we think about new drugs, right? Because this is the technology is, we're still kind of working out where does the technology fit in the ecosystem of regulation. So I think there's a lot of action needed from regulators. But actually, from my perspective as in obs and gynae and women's health, we still need like the basic research. The data gaps need to be filled. And this isn't AI specific, but, if we don't have the information on pregnancy, if we don't have information on the impact of the menstrual cycle and inflammation and hormones on women's health and symptoms, like I said, AI can't fix these problems. Like, can we do a hell of a lot with the data with AI? Absolutely. Can we do loads of education and personalization of information? Absolutely. But it doesn't detract from the fact that we still need those basic answers, that historical imbalance in research funding, that needs to be addressed. So a really big part of this for me in terms of seeing real innovation and progress. And actually, now I'm talking a lot, but so oncology actually is really well funded. So cancer is one of the best funded areas of medicine from a research perspective. Cardiovascular disease, oncology, obs and gynae, so like women, like all of the other stuff that women's health kind of falls into from a medical perspective, is one of the least funded, and so is paediatrics. So I'm not surprised that one of the first AI trials is an intersection of radiology and oncology, but we need money coming into lots of other areas of women's health so we can get to this level of maturity and innovation. I think that's really, really important. And that's really across the board, funding priorities, funders, charities, public awareness. And I think that's what's really exciting, is now that actually women are no longer putting up with it. We're getting so much more advocacy and movements about women being like, what the hell? Like, how is it that after this much time, we don't know what the impact of the pill is on my longer term health? I've been taking the pill for 20 years. How do we not know this? I think we're really seeing a shift in, not because of from the funders, but from women. And I think that's really, hopefully, I hope that Anna's women generally are taking more positions of power on, it's been generations only where women are being in more leadership roles. I'm really hoping that we start to see this change in the whole landscape.
Thank you so much, Fran. Those are some amazing points. Annalisa, do you have anything to add to this?
Yeah, I think even within this this group, we've been discussing about this topic quite a lot, which is because I think it's very important point that we need to raise awareness about, that there isn't much funding for those women-specific health and also children-specific health issues and problems. They're at the moment not receiving enough funding. So there are a bit of funding available just for, you can see them once in a while, they just come up, and then it's all again down to cancer and oncology. So I totally agree with you, and there is I think a lot of work to be done to probably make society and funders aware that this is a problem, and there is a lot of research going on in the background that needs to be funded to get to the point where everything else is, and just to support it to make sure there is the right level of development as in other fields. Just to go back to the question that Christine asked about where we see AI going, I can see that in the past or up until now, I think there is there's been a huge development in the technology itself. And from now on, I think we're starting to, and I'm hoping to see a better alignment between AI or technology and the actual application. So it's not the technology as a person who develops AI model. I've seen that the field has been stressing about the accuracy of the model itself and competing against another model and just making new improvement just for chasing the accuracy, making sure that the model is as accurate as possible. But I still believe that although accuracy from a technical perspective is important, having the impact sides on hand, or just thinking of how you're going to apply that model and how that model can be interpreted or used in a clinical setting is as important as the accuracy. And maybe the accuracy will come at a later stage once the model has been probably well designed with the clinical input on board, and then we can work on the on improving the accuracy. But I still believe that what AI is going to do in the next few years is just aligning better with the clinical settings, and hope that will be the right trajectory.
Great, thank you so much. Really appreciate all of your answers. So I think Bianca, we're going to go to the Slido now and just take some questions from the audience. So please keep adding to the Slido as you come across things, and please, keep upvoting, and we'll kind of go through that list next.
Yes, and I would like to thank again all our panelists, because there's so much to unpack in what you've said, and I could talk about these topics for hours, so I will not do that. But I will instead take the first question that has been raised by most people. So this is Lucy's question, and she's asking, they are asking, can you share an example or experience where you have received support in your career development, and what did that look like? How can we encourage support? And I think this question is for all of you.
Thanks. That's a really, really great question. And I can think of so many examples of where I've received so much support, but I think I'll keep it to 3 maybe and keep it short. Three people who have really supported me on this AI journey have been partly through UCL and also the university I'm affiliated with, and also just a random person I met at a conference. So it just goes to show you the power of conferences and connecting. The first person is Professor Piers Keane, who is, as I'm sure many people will know, a professor of AI who works at Moorfields, who's actually an ophthalmologist, but has done amazing things with Google DeepMind and brand collaborations with various industry sponsors and huge, huge databases. And when I was thinking about how I would put a grant together for AI for children, I saw him at a conference and he gave an amazing talk. And I just thought, do you know what? Just give me some pointers where to go, and that would be it. But he took it upon himself to mentor me, to have meetings with me, to look over my grant, to practice my interviews before the grant application, and to just kind of direct me in what would be a successful NIHR application and what would not. And it was really so lovely to have someone to spend that time who was from a completely different specialty, because they really believed in creating AI visionaries of the future. He then introduced me to another person in UCL with a completely different aspect of AI. So he's very technical, very data-driven. He introduced me to Professor Angela Aristidou, who is a professor of business psychology, organizational psychology at the UCL School of Management. She was running a course on AI and business. And he said, speak to Angela, get on her course and see what happens. And I thought, why do I need to know about AI and business? Like, I'm a doctor. This seems so ridiculous. But I spoke to her, we had coffee, and I went on her course, and it really showed me the importance of thinking about things in a systems and organizational way. Don't just think about your department and your problem. How does this fit into the bigger picture? How are you going to drive change, not just move the bottleneck further down the care pathway? You know, what are you actually trying to achieve here? And so having that sort of business organizational psychology kind of thought really helped me. And since then, I've seen Angela at various conferences speaking to vendors and big industry partners. And she said to me, oh, come with me, come and sit in with me with these discussions. Just stay silent. You don't have to say anything, but really just watch. And watching how someone talks and runs a meeting and really gets their point across in strategic conversations is really great, because I never had that experience. I've never had someone in a leadership role say to me, sit in on a leadership meeting and just watch, just observe what happens, just understand the language people are using. You're now playing a different game when you're talking to a different player, you know? So that has been mind-blowing for me. And then the last person was someone I met at a conference. I forget which one now, is Dr. Keith Grimes. He's a GP by training who has done so many digital transformation projects himself. And I met him, I think, through a BMJ related conference, who took it upon himself to basically teach me and a few of my friends in a very private tutorial online about how we prompt engineer, how we use ChatGPT and Claude for personal productivity. That's been a massive game changer for me in analyzing data, looking at things, understanding how AI works, especially generative AI. And, you know, just following what he says on LinkedIn and his thought processes about different technologies, that's been huge for me too. So I would say really it's about people who just see the importance of creating AI visionaries themselves and really take it upon themselves as a personal mission to help others become like that has been the key. And just say hi to people at meetings. You never know where it can go.
Yeah, also love Keith. Met him at a conference recently, and he was like, just try it. He's like, you just got to try it, you know. And once you start playing, you'll work out what these things can and can't do. And I took his advice, and I've been playing with Claude and all sorts. And yeah, I mean, my gosh, my grant writing, that you very quickly learn what it can and it can't do. And if you haven't used these tools before, use them, because they're free. Or at least there are free versions available. And you know, it's really amazing to work out what the kind of generative AI can and can't cope with. You know, and for personal productivity, I completely agree. I think my take in, I completely agree. Everything's always about, it's all about people, as it always is. And I guess my angle is, like, a clinical academic career is really tough because you're doing two very, very different jobs. And when you kind of nurture one and you lean into one, you kind of, the other one suffers. So I'm really in the academic zone at the moment, but I'm going back to clinical. And obviously I've not been doing proper clinical work for a few years, and that transition is going to be hard. And I think, and you also get this, because it's a sort of jumping across institutions, like there are contractual issues. And I think the way that, one of the things that I've encountered recently is, you know, actually, like, job security. So like the clinical job, we're very lucky as doctors, we do have job security, but actually from an academic perspective, you know, I can't apply for a lectureship because I've not submitted my PhD, but that means that I don't have, you know, the academic funding. And my only option would be to work full-time clinically, which isn't an option for me because of the situation that I have with my family and my young son. And so there's like really real world problems of like navigating a career as a woman, particularly if you have a family, I think. And one of the people who's really just taken the time to like listen and then actually do something about it has been one of my PhD supervisors, Antonio de Malval at KCL. And he's a cardiologist, he's an academic, he's a senior lecturer now. And, you know, he's running all kinds of interesting programs. And like, absolutely, he's been brilliant from an academic perspective. But where I really have valued him is that he's found some time to speak to me about like what's going on in my world and what my like day-to-day issues are. And he's like, okay, I'm going to try and find some soft academic funding. And he's found me some soft academic funding to get me through to my clinical AI fellowship. So there's a very different version of me that I could present to you today, but I'm giving you, like the sunshine and rainbows story of my career. But, there are also some really real challenges. And I think finding people who can help you navigate that and provide the support in this, because there's some real pinch points in these careers. And I think Annalisa might talk more about academic insecurity, because academia is hugely insecure. And I know we're very lucky as clinicians that we have clinical medicine. So I think, really finding people that you can trust is fundamental to be like guiding you through these points. And for me, that's really just changed what feels possible for me in the next sort of 12 months and going forward. But absolutely, people that you can trust and network. And you often find the most interesting conversation, as Susan has alluded to, are people outside of your direct field, because there's so much going on in other sectors. Can't emphasize that enough, really.
Yeah, it was a similar situation for me. So if I have to think about how I got to this position, there'll be like plenty of people that I should thank for their time. So it's just the idea of finding that right person, the right time, that shows you how things should be done and how you should move yourself in the academic field. As a woman, for example, and when I was in Cambridge, everything started with, I was in the computer science department. It was Mateja who started the Women at CL. So CL stands for Computer Laboratory. And it was like a network of women studying computer science. And at the beginning, I was involved like as one of the women doing PhD, but then she said, okay, why don't you run the network? So I started running the network. And, at the beginning you think, oh, I'll never be able to do that. And then you start running the network, and then you keep growing. And the way I did that is, again, because you find someone who actually, and we go back to what we were discussing in the beginning, you find someone that believes that you can do, although you don't think you can do. You just say, okay, if they give me this role, I probably should believe a bit more in myself. And that's how it started. And as well as my supervisor, Pietro Leo, PhD supervisor, taught me a lot in the specific technical field, but also in the academic field as well. And if you are in an institution at the moment, there are always mentoring schemes. So especially in the academic setting, I'm not sure in the clinical setting, but there are academic schemes that match you with an academic mentor. That doesn't have to be within your sector. It can be someone external, but can guide you to grow from an early career researcher to a middle career and then senior staff. So in every institution, there should be some kind of mentoring scheme that can support you. And again, the networking at conferences is one of the most valuable opportunities that you can have, even if it's not with talking to someone with a higher level in terms of career, but even talking to someone that's the same level like you in a different settings, it will just help you grow so much, and just developing that type of network that would be needed for the future. So networking, but also find that right role model that you'd like to follow. It's one of the key points.
Great. Yeah, thank you so much for these answers. It's very inspiring as well to hear, how you've gotten here and all the people that have helped you along the way. So we're going to go to the next question on the Slido that currently has the most likes. And I think this is something I'm interested in as well, as an American who also does half of my research about everything in the States going on. So basically, this person was asking, are you worried about the current political situation in the US and how it will affect women's health research in general?
I don't know if that question is directed at me, because I don't do women's health research, so I might give a pass on that one.
That's okay.
Yeah, I mean, I think I would say it's just, I think it's sort of scary, because I think there's a degree to which we think forward progress can't go backwards. And I heard an author on Radio 4 talking about, how we, she could have respect for people's sort of anti-abortion stance, but you cannot impose that on other women, because women are in charge. That the only thing you have is your body. That's the only thing you really own and have like autonomy over is your body. And I think what's really scary is that those rights and that autonomy, even if like I said, there's a whole minefield there, but I think, the political climate and what it means for women's reproductive rights particularly it is scary. And I think it is really worrying that you can see that it can be backwards. I mean, one of the things that I've been thinking is that actually, I wonder what politics and tech would look like if there were just more women in power. And this is not about like women in AI. This is not like women's health specific. I just mean like political power, like financial power, like the C-suites of like the Fortune 500. I don't know much about, business, but this is where I'm like, if there were more women in these chambers, and I'm not sure that would fix the problem, but I think there would be at least more balance. And I think, it's what impact will it have in a UK and European setting? Hopefully minimal. I mean, we have seen obviously diversity initiatives being pulled in these big tech companies, and I think that's a real shame that everyone's pandering to obviously the change in the political climate. I don't think that Europe and the UK will be swayed by what's happening in the US. I think, and we have made a lot of ground, but equally, I think it reminds us all of our vulnerability, and actually not to take our progress for granted. And that I think we need to really be thinking like, how do we lift each other up? Because the more women that are in power, obviously there are not all women are the same. Some women might be really pro-life, and that's fine. But I think just about trying to get that diversity and representation all the way up the chain, because I'm sort of thinking like, how do we fix this problem? I hope that at least will make things better, because you just have, it's different when men are thinking about women's issues compared to when women are thinking, because we live it in a completely different way, and we're vulnerable in a completely different way. And I think that's my very, very personal take on it. But of course it's worrying, but will it impact like NIHR research policy? I don't think so, but there's still a huge amount to be done to get women's health like on the agenda. But luckily my boss is Lucy Chappell. She's CEO of the NIHR, and she's an obstetrician, so she's working really hard to get women's health onto the research agenda in the UK, which is great.
I just have one very small thing to add. I think Francis' answer was very complete. I believe that what's happening in the US will kind of affect not just research in women's health, but research overall, because one way or the other of another, Europe and the world is just going to be influenced by any decision that's going to make in the US, because we kind of not rely on them, but we collaborate with them a lot. So I do have several projects with US researchers, and they are, of course, really worried about the current situation and the cuts that have been promised to the research in terms of overrides and extra funding that usually private institutes or public institutes receive. So it's a very uncertain climate that we're living in, and we don't know what really is going to happen. But for sure, we will get a kind of impact if there's going to be funding cuts from the US. Although we're not totally related, it's not going to affect us directly. We will definitely have an indirect impact on what we're doing.
Susan?
Hi, yes, just to follow on from that, maybe not so much research, but implementation is also a big issue here. So we talked a lot about AI, talked a lot about radiology. A good place where AI radiology can really make an impact is in underserved countries and in global health issues where there's no doctor, no radiologist. So even maybe not a perfect AI, but a slightly better AI is better than like zero help at all. And a lot of global health charities are saying to me, oh, the US has pulled aid funding, not necessarily research, but aid funding. And we were reliant on that for really developing some of our global health initiatives. And, the Gates Foundation can't fund everything and other organizations can't do it all. So there's also a huge risk that AI to get to the people who need it the most may not happen because of the things happening in the States right now too. So that's also another thing we need to be mindful of.
Yeah, absolutely. I think I fully agree with what you said. And unfortunately, we are running out of time, so we could keep talking a lot about these, but I would like to maybe ask the panelists a last question from the Slido, which is quite different, but I think still very important. This question is mostly to do with minority genders and transgender communities. So the question was, oh, it disappeared. So strange. I cannot find the question anymore. Yeah, I can find it again. Okay, sorry. Most of these issues being discussed are exacerbated for minority genders and the transgender community. Is there anything AI can do to help address this? Again, I think the question is for everyone.
Thanks so much. I think that's a hugely important topic. Obviously, we talk about gender as it's very binary, but it's not, obviously. I think before we think about how AI can help this, we need to really correct the data. I don't know that we even have enough data to know about the problems or to identify the people who suffer from this. My understanding is that if you change genders, that you get a completely new NHS number, and that it's very hard to link back to stuff that's happened before, and you may have healthcare problems that might now not be recognized necessarily. I don't know as well, and someone who has this lived experience can inform me whether or not it's even possible to highlight that you are non-binary when you submit your NHS information. I know a lot of patients find it really hard even to just change their home address, let alone something like that. So I would say we need to start with the data first before we even build these AIs that can help with this matter.
Yeah, I completely agree, Susan. I think, we need to think about intersectionality. So obviously, gender and sex is one area of inequality and data gaps, but when you start to intersect that with other protected characteristics like ethnic group, like socioeconomic status, like pregnancy, these are things which individuals who are at the intersection of multiple, so if you're a pregnant woman of Black ethnicity, the data pertaining to you that's relevant to you will be even less than the data that is pertaining to a European non-pregnant woman, for example. So there's the data gaps become even more difficult, and or rather the data becomes even more sparse when you consider intersectionality. And I think I think the broad themes that we've been talking about today, so like AI can't fix these data gaps, I think that's absolutely true when we think about this area, is that we need to have good data. And I think there's a very real problem when we think about sex and gender in the NHS, because of the way that this data is captured. Actually, a bit like ethnicity, it forces you to tick a box, and the box often isn't fit for purpose. Therefore, we're quite limited. And again, AI can only work with the data that we have. So this is, when I'm saying we need to have these conversations, is because even the way we collect the data is so important, how we ask questions, what options there are, because all this data eventually can be used for models and for greater good, but it depends on how that data is captured. And I think there's real complexity in that detail.
Yeah, I wouldn't touch more than that. It's just the problem with society itself and how we are at the moment collecting data. So it's just the same issue that we were discussing before with gender minority. It's kind of probably another minority of that we need to be aware of and needs to be raised. We need to raise awareness around that issue as well. And I think this is the right way of doing it. Just the more we talk, the more awareness we raise, and hopefully the easier it will be to collect this type of data as well.
Amazing, thank you so much. And I'm afraid we are running out of time, so I'll let Kristen wrap up. But I'd like to thank all the speakers again, because that was so interesting. And I think everyone here can agree that there was a lot we covered, and we need a lot more time to cover all these topics in more depth. Yeah.
Yeah, thank you again so much to our panelists. It's been amazing having you on, and I think the insights and the topics you've discussed here are incredibly insightful and incredibly useful to all of us. And I wish we could talk about it for an entire day, which hopefully we can, actually, because we are having our first in-person event, as Bianca mentioned, in June. So hopefully these discussions continue, but thank you so much for giving your time, especially around International Women's Day. I think it's really important that we keep discussing these things, especially in the political climate, and we keep sort of building communities journeys, and we keep in contact with each other, and we work together and collaborate with each other. I think that's incredibly, incredibly important. And I just wanted to mention, there's also a clinical AI interest group meeting on the 25th of March. And Malte Gerhold is talking about no opportunity without strategy. So it's government's AI opportunities action plan and what that could mean for the NHS. So if you're interested in that, we can give you a link as well to register for that meeting. And then, just keep an eye out. We'll put in our newsletter, and we'll put more information out about the meeting that we're going to have in June. And we hope to, see you all there. So thank you so much for attending. We really appreciate it.
Thank you.
Thank you so much. Bye, everyone.
Bye, everyone. Bye.
Thank you.